Today we're speaking with Lisa Hilmi, the Executive Director of Core Group. We're going to talk about the issues healthcare professionals are facing and some of her insight and resources that are available. So we're going to start with asking about what are the most important issues healthcare professionals are facing in this global pandemic, and what's your biggest concern at the moment, Lisa?
Mhm. Well, thanks so much for this opportunity to speak. As a nurse myself, I know that healthcare workers are really at the forefront of the response, and in my opinion, the heroes, and will go down in history as really the providers that have been at the most risk. They're caring for patients, communities, oftentimes their own families in this hour of need. Um, we know that supply and demand right now of personal protective equipment as well as testing is really putting them in danger. There's also been an access to technical information, especially in rural communities and those rural community health workers. There has been also a real lack of guidance on policy. And we find that some organizations that we look to be the gold standard are often contradicting each other in recommendations. And so we really urge WHO, UNICEF, CDC to come together with recommendations that are standard for all. We also noticed that healthcare workers are having difficulty with reaching certain populations, the rural and pastoralist communities, as well as vulnerable populations like people with disabilities and people in refugee camps, as well as urban settlements. Can you imagine how to maintain social distancing in refugee camps as well as these urban developments, and trying to reach populations for information and treatment? So these are some of the main things that we're hearing, not only here in the United States, but globally, in many of the countries, both in the rural and urban environments.
You're hearing that, and then what is Core Group doing, or how are you working with organizations and nurses to help fill that gap, or what can be done?
Great. Well, Core Group, we're very lucky that our foundation is based on collaboration, and our network is comprised of global health practitioners from around the world, as well as other stakeholders such as the actual health workers on the ground, civil society organization, Ministry of Health, donors, private sector. For 20 years, we've had a Core Group polio secretariat in 7 countries, and those have been activated now to look at global health security activities, not only from a surveillance perspective, but information and education. Core Group globally has been hosting since February COVID collaboration calls with different themes every week. And we have over 70 countries represented and often more than 570 participants from around the world. Those are on Friday at 10 a.m. Eastern Standard Time. We've uploaded a COVID resource page with relevant resources in multiple languages from not only WHO, UNICEF, UNFPA, but also many of our partners. So very interesting resources, and they are delineated by topics such as gender, clinical guidelines, et cetera. Additionally, in the beginning, we did a rapid needs assessment, which is identifying some of the gaps around the world, and where there's often a lot of duplication. So we're trying to bring different organizations together that are working on the same thing. And just one example, with home-based care guidelines, we found there was over 10 organizations working on the same item. And so we're bringing them together to save resources, as well as to foster that collaboration in conjunction with the UN and ministries of health. And lastly, we'll be launching a needs list platform to address some of the supply and demand needs in commodities and knowledge management products. So people can reach out to me if they're interested in being part of that supply and demand platform in various countries.
Yeah, I think what you're showing too is the value of having a platform in place for something like polio that then you can use for in the event of something like this happening. Um, also, how much what percentage of your time are you talking about COVID, and then also continuing everything else that nurses are doing in terms of standard care and general health?
Well, absolutely, because what we're finding, and especially for women, with 75% of the health workforce being women, they are asked to be caregivers at home, patients, professionals, often homeschooling their children, an increased workload. And as core group, we have our regular activities as well as healthcare workers have their regular services such as pregnancy, family planning service, and we're finding these are really difficult to access right now. So that's been a concern. And then issues such as gender-based violence have been increasing, and a lot of the recommendations are starting to disseminate regarding how to address this from both a policy and program level. Um, I think, especially for women, this has been just a very unprecedented time. And we're going to see not only the health effects, but also social and economic perspective for women, and cascading upon families and communities. It's been a real hard juggling act. And I know much of the development community has suddenly had to switch to humanitarian response. And we find that there's an often divide between the humanitarian and development communities. So it brings to light that health systems really need to be strengthened, as well as this divide. We call it the humanitarian development nexus or divide of the communities speaking to each other from a health worker's perspective, as well as policy.
Okay, great. Thank you very much. Now, this week was World Health Worker Week, and we saw a lot of sort of celebration online. And I'm wondering, from your perspective, now, it's actually Friday, the end of the Health Worker Week, but the need to celebrate health workers is going to continue. What do you think is the best way for people to be celebrating this profession?
Great. And I think it's amazing we can celebrate and applaud healthcare workers. I know when I was clinically working in the hospital in the emergency room, I received my pen and I received my bag. But I have to tell you, we have to do more. And one of the things that this has emphasized is that health workers are vital. And we need them to be safe. We need them to have personal protective equipment, safe environments to work. We need to eliminate the stigma around that health workers are facing now, often being asked to stay outside their homes, or spat at, yelled at, thinking that they carry the virus now. This is emphasized that health workers need to be paid an equal wage and not be expected to carry the burden of this disease or any future healthcare work for free. There's always been a debate about community health workers and should they be paid, and Healthline volunteers, should they be paid. And this pandemic has emphasized more than ever that community health workers and healthcare workers need to be paid an equal wage and a fair wage. We also hope that the voices of healthcare workers come forward. There's been a lot of great work, and like our colleagues, frontline health workers have been elevating the voice. Many of our core group members have really shown videos, and hearing directly from those on the front line are so important. And again, just as we celebrate and elevate the real needs of healthcare workers and the important work that has been done, we need to address the gender issues immediately that healthcare workers face, not only for this response, but we must have gender transformative approaches and indicators going forward as far as healthcare workers and all the work they're doing.
Yeah, I mean, a lot of these issues were always there. This is just kind of casting the spotlight on them, right?
Absolutely.
Well, thank you so much for all this great information. I think that, the resources you mentioned that are on your website. We'll provide the link there. And is there any other sort of resource you would direct people towards or encourage them to look at?
Great. So again, just going to our website, which we've incorporated the WHO guidelines, UNICEF, all that UN, but also some academic and clinical guidelines, and they are delineated based on subject matter. So you'll find early childhood development guidelines for COVID, as well as gender, disability. The disability groups, when I'm talking about those hard to reach population and often ignored population, they're doing a lot of great work, and we've been putting that on our website also. So please go look it up. And if you're interested in hearing more about the supply and demand needs list platform that we'll be launching, please reach out to me.
Great. Thank you so much, Lisa.
Thank you so much, and have a great day. And thanks again for this opportunity.